You are with the big story here. Hope all of you doing well, keeping safe, keeping isolated at home and respecting the guidelines of the lockdown. Let's make a start in getting you the figures first. I'm Seher Zama. Right now we're looking at a total of 4,421 positive cases reported so far. The numbers have sharply risen once again in the past 24 hours. We've seen a total of 354 new cases reported in the past one day. The death toll has further climbed up. It is currently at 114. As we speak, we are looking at day 14 of the lockdown. In a total of day 21 that have been given to us, this is a lockdown that could continue, that could not continue. Remember, cabinet meetings regarding this have taken place. Smooth exit plan that is being discussed as well. But as far as we on a personal level are concerned on how we can continue keeping ourselves safe, not just a question of staying at home, but building up our immunity as well. This is crucial to our existence. This is crucial for our general well-being, and more importantly, also to keep ourselves strong and secure in the midst of this outbreak. We have with us expert with us this afternoon. Appreciate Dr. Raghav Sharma being with us here at the big story. Dr. Raghav Sharma, who's the head of R&D healthcare at Dabur India. Thank you so much for being with us, Dr. Sharma. The prime concern for a lot of us staying at home here is on how we can continue keeping ourselves, our physical structure, our body, our physiology strong. And that, of course, would entail building up a strong immunity. Is it something that can be built in a couple of days' time, or is it something that is long-term? What would you suggest at this point right now?
Yes, sir. Immunity has played a very important role right now in development of symptoms in corona patients. We all know that, the people who have a strong immunity, they are less likely to have severe symptoms. And Ministry of Ayush, Government of India, they have also issued certain advisories to help people who are staying back at home to improve their immunity by doing normal and very simple things. And one of them very important is, the daily consumption of Chyawanprash
Okay.
that is recommended is that. And I tell you, we have done a lot of research on Chyawanprash, and it's not just the historical evidence or historical knowledge. It is also the science which we have done on it. It also proves that it helps in improving the immunity of a person. We have understood the mechanism of action. We have seen that immunity markers, they get upregulated when the verified models, when we test Chyawanprash in them. TNF alpha, it plays a very important role, interleukin
Right.
1 beta, MIP. So these all are upregulated and these are the cytokines secreted by dendritic cells, and which are very important markers of immunity modulation. So these are the things and also one can keep taking
Right.
tulsi, giloy.
Dr.
These are
Sharma,
the
you're talking
supplements.
about Chyawanprash here. Right. So we're talking about Chyawanprash, this being a product that could be at this point of time off the shelves, not available. What are the other easier measures possible if there is an unavailability of Chyawanprash in certain areas, in certain pharmacies and shops here, or what's really just available at home, easily available in your refrigerator, that could be used, eaten, consumed to build immunity, and that could show fast progress as well, because immunity really is something that is built in a long duration of time. It's a slow build in your body.
Yeah, exactly. So, although Dabur is trying to supply Chyawanprash to every corner of the country right now, but still, if at some place, if this is not available, then people can resort to very simple measures like haldi. If you can take a half teaspoon of haldi mixed with milk, it also helps
Okay.
quite nicely. Tulsi is another very commonly found medicine and herb which probably is available at every household in India. So Tulsi leaves are also very effective and important in building the immunity, showing anti-infective action that can also be adopted. And also I tell you, very important part is of remaining stress-free if people can start their day by doing a little bit of 15-20 minutes of asanas and pranayam and meditation, so that helps them de-stressing themselves. And stress, if it
Uh-huh.
is relieved, it also helps as a immunity booster. So these are certain simple things. And for de-stressing, even ashwagandha, it's a commonly available medicine. One can take it and help in reducing the stress. So along with Chyawanprash, these are very simple measures like taking curcumin, which is haldi, with milk, tulsi, guduchi, one can, resort to. And also there are certain spices in the kitchen like
Okay.
dalchini, kali mirt, ginger. If one can take tea mixed with these spices, or maybe even, if without even adding tea or sugar into it, make a decoction, simple decoction, and use it. These all would certainly help in strengthening the immunity. And as you rightly said, immunity cannot be built immediately. So one has to continue taking it for a long period. And but in this scenario, when there is no other vaccine or medicine available, I would suggest people to start these measures as soon as possible, so that over a period of 5-10 days, these things they start showing their
Right.
result in.
That's right. Dr. Sharma, at this point, it will also be important here to clear up the confusion that these are our Ayurved, Unani, natural herbs available, which are at the end of the day building up our immunity, making us stronger and not susceptible to any virus. But it's important to draw that difference here, that this is not a treatment. This is to be on the safe side, to build up your body strength, but it can't be a treatment.
Yeah, certainly. This message has to be very clear, and this has to be very, bold and strong, that these things can help in building the immunity of a person. These are not a replacement for any treatment or any sort of, guarantees assured by using these. So one has to use them with a, wise conscious, and with not considering them as treatment for COVID-19. And these things would certainly help. This I can say because we have
Yes.
seen in the research, but there is no 100% evidence that these would work in any sort of condition of COVID-19. In fact, government of India is
That's right.
planning to
Also,
conduct.
Dr. Sharma, because we're looking at. Please complete your point.
Yeah, so wherein the value of such interventions would be evaluated in COVID-19 cases. So it's a welcome step, and we have seen in China that adjuvant use of TCM has worked wonders. And same way, we expect that inclusion of these Ayurvedic interventions, these herbs, these spices, Chyawanprash would certainly help in fast recovery. But then this has to be proven first, and then has to be authenticated.
Right. Also, Dr. Sharma, because we're looking at different ages across the board, the concern is to help build immunity for your family. This would include senior citizens. This would include children and youngsters as well. As far as taking Ayurveda and Unani herbs in doses is concerned, is it general across the board, across ages, or are there precautions to keep in mind if it's being given to senior citizens and young children?
So usually these drugs are pretty safe. I would say that even in higher quantities, they're not gonna harm anyone. But then a person can adjust the dose of the of any intervention they're
Yes.
taking according to run. So 10 gram is advocated for Chyawanprash. Children can take it in a very in little less dose, like 5 grams in a day. Same is the case with high quantity, although 10 grams is not a very high quantity, but they can reduce the dose as per their body's acceptability. And also, diabetics, they can take a sugar-free version of Chyawanprash, which would help, even maintaining their sugar levels also. So that way, the dose titration is very important. And although there wouldn't be any harm per se, but it would be always good to adjust to the dose which is suiting to one's, own body.
Yes. Absolutely, I agree with that, Dr. Sharma. That's the beauty of as far as natural herbs is concerned. Of course, allopathic medicine has always looked at it rather critically here, but at the end of the day, it never does you any harm. It only helps positively. Dr. Sharma, many thanks for speaking with us here on Mirror Now. A very important message there being sent out here that the best we can do while we sit in home and sanitize our areas, it's also to build immunity. It's not something that is going to be built in a jiffy. It's in the long term here, but this is the best that's in our hands right now. Stay on with us, please. Back in just a bit.